to you by Holy Name Medical Center in Teaneck, New Jersey.
We've begun a virtual dementia tour where we take our staff, specifically those involved in direct patient care, and put them through a simulation that mimics what it would be like to experience dementia. So we put headphones on them to obscure their auditory sense. They hear voices, there's background noise. We put goggles that obscure their vision, gloves on that decrease their tactile sense, inserts in their shoes that make it uncomfortable to walk like it might if they had neuropathy. And then we give them instructions, 5 very simple tasks that they need to go into a room and do. And it's very enlightening to them when they realize they're afraid.
Powerful. Steve Adebato, more importantly, let me introduce our very special guest you saw in the video. Cedar Wang is Director of Simulation Education at Holy Name Medical Center. What were we just looking at?
We were just looking at our dementia sensitivity training experience, in which we put our healthcare providers through a scenario that makes them feel like they have dementia.
Why?
For 5 to 10 minutes.
Excuse me, for 5 to 10 minutes?
Yeah, 5 to 10 minutes. They get to experience what many of our patients live with day after day, and family members have to face. So the reason why we do that is because we feel like it gives them a better understanding. It makes them a little bit more patient when that patient asks the same question for the 10th time because they've lost their short-term memory due to dementia.
So, how many people, how many people are dealing with dementia right now?
Right now, according to the World Health Organization, 47.5 million people in the world have the diagnosis of dementia. More importantly, by 2050, that number will triple. So we're watching what they call a silver tsunami of an aging population, those over the age of 75, 80. That's the largest segment of the population that's growing. So,
Cedar, for those of us who have loved ones who are dealing with dementia right now, and we say things like, we can't imagine what they're going through. You literally are trying to have healthcare professionals imagine.
Not only imagine, but actually experience what they might be feeling.
How close is it?
People,
how do you know?
We wouldn't know. We wouldn't know. But the kinds of feelings that our participants describe are very similar to those with dementia when they're able to articulate what they're experiencing. Things like fear, embarrassment because they can't remember the instructions that we just gave them. Well, not being able to remember is something that people with dementia experience every day. They do have an awareness that they can't remember. And so many times they'll try to compensate by doing word puzzles or doing things they do feel competent at.
They are aware?
They are aware.
You see, they are aware. I don't want to get too deep into this. People with dementia are aware that they have dementia?
Absolutely. Yes, especially in the early stages, they are aware. It's really not until the late stages that they're no longer aware. But most people will, usually people will go to the doctor, some will go to the provider by themselves and say, I'm having memory problems. We hear many people, many older folks complain about memory problems. Right. For some it is just a slow decline, but for others it is a diagnosis of dementia.
For medical professionals, how does it help them be better at what they do and help those who are dealing with dementia and those family members helping those with dementia?
I think it raises awareness within their own soul that this is an issue that is not just someone's problem and not their problem when it walks through the door, but if we are able to give them just a glimpse of what it feels like and to connect with that emotion, we really believe that it does change their attitude about dealing with patients with dementia. And so when we took our over 400 of our staff through this experience, we did demonstrate that their attitudes about dementia changed.
So the emotional reaction you got, describe it.
Very emotional, especially for those those members of our staff that have a close family member that's currently dealing with dementia. We had many tears shed in our simulation lab after they experienced it, just not even imagining, feeling for their loved one so much. They just had to experience it for 5 or 10 minutes, but it's something that their loved one lives with constantly.
Acting as if it's not real, or acting as if, well, let me try it this way. We have to deal with this.
We do.
The alternative is what?
The alternative to?
The alternative of not finding better, more effective, more relevant, more empathetic ways of dealing with dementia and its impact on people is what?
Well, it certainly leads to ineffective care for the person with dementia. It leads to more burnout of caregivers because of just the frustration. There is a level at which it's a little easier for a caregiver to understand if they're empowered with a little knowledge. And so if they understand that their loved one's behavior is not anger, is not frustration, but really is a disease process, it's a little bit easier to understand.
It's so interesting. If I say who the loved one is, she'll know and she'll get really mad that I said this, so I won't do that. But the loved one who is the caregiver will often say to me, he makes me so angry.
Exactly.
But
Yeah.
He's not trying to make her angry, is he?
It's not trying to make her angry, absolutely not. It is, dementia is a progressive illness of the brain.
Can he help it?
He cannot help it. He cannot help it. And that's the challenge. And that's what we hope this training reveals to people, that people's behaviors are due to an illness, are usually due to the illness. I won't say all the time because nobody's perfect, even when they have dementia. But we do have to default to that the behaviors that we're seeing, the anger, the frustration, it is due to the illness.
And so what is the caregiver supposed to say?
Well, oftentimes the caregiver can't really change what they're saying, but hopefully within themselves, they have a greater peace knowing that it's the illness, it's not something targeted at them personally, but it is just part of the disease process.
You love the work you do, don't you?
I do.
You make a difference every day.
I hope so. Yeah, gerontology is definitely a love of mine.
Well, the simulation education work is powerful. And it helps people see things in a way that they otherwise just wouldn't, even if they were the best clinicians in a certain area, technically.
Right, exactly. I think it speaks to the heart.
Yeah, and then real quick, 20 seconds, the other simulation education is in what areas?
We do emergency responses to cardiac emergencies, obstetrics. We're expanding out into disability training.
We just had a whole conversation on Caucus about that with a whole group of people. Cedar Wang is the Director of Simulation Education at Holy Name Medical Center. I want to thank you for joining us and helping us learn. Thank you.
My name is Dr. John Brundback. I'm actually the Medical Director of the Interventional Institute here at Holy Name Medical Center. Peripheral arterial disease actually is extremely common. It's one of the forms of hardening of the artery. As interventional radiologists, we perform minimally invasive image-guided procedure. Generally, the procedures we do are alternatives to what would otherwise be major surgery. Almost 80% of those patients can avoid amputation if they're referred for us for these sort of procedures.
Holy Name Medical Center in Teaneck, New Jersey, 1877 Holy Name. Healing begins here.
Also brought to you by ShopRite Supermarkets, Seton Hall University, where leaders learn, and by the New Jersey State Nurses Association and the Institute for Nurses.